You, our KIRO 7 viewers, have been asking us a lot of questions, including, is it possible for you to get COVID-19 through your eyes? Here's another question that came in. Can temperature checks catch all coronavirus infections? KIRO 7's Matthew Smith, once again, separating fact from fiction.
A viewer wants to know, can you get COVID-19 through your eyes? This is an interesting question. There is an epidemiologist, Dr. Fair, based out of Kentucky, who told MSNBC he thinks he contracted the virus through his eye while on a packed flight. He was even hospitalized. So the statement reads, you can contract COVID-19 through your eye. We're going with undetermined. Now, to be clear, there is research being done on this, but it's too soon to say. The most common transmission, respiratory droplets, hence the masks. But the CDC says this, quote, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. Next, let's talk about the flu shot. There's a lot of talk about whether getting a shot can lead to false positives when it comes to the COVID-19 test. Fact or fiction, the flu vaccine makes people test positive for COVID-19. That is fiction. The CDC explains online that the flu vaccine comes from an inactivated flu virus. Coronavirus and influenza are different things, and going one step further, they're still recommending that you get that vaccination. Next, we're hearing more about temperature checks, right? Well, one viewer wants to know if you could have your temperature checked, be normal, and still be sick. So fact or fiction, I can have a normal temperature and still be infected with COVID-19. That is fact. Now, to be clear, a fever is common in COVID-19 patients, but we've also reported on asymptomatic people, those who don't show symptoms. One thing that may calm some concerns here, the CDC says risk of transmission is thought to be greatest when patients are symptomatic, since viral shedding is greatest at the time of symptom onset. So, stay safe, and as always, thank you for sending in submissions. Matthew Smith, KIRO 7 News.